health systems, primary health care is a very critical component in this conversation. That for UHC to work, we need to strengthen primary health care. And the question is, when you look at the distribution of NHIF payments, when you compare the private sector and the public sector, currently the private sector receives about 85% of the payments from NHIF, and the public sector receives about 15% or slightly less, just about 15% of payments from NHIF. Yet, when you look at the numbers of private facilities and public facilities, or the proportions of population served by both, they are not that much different. You may find that maybe the private sector is serving 45% of the population, or the public sector maybe something like 55% of the population. So in an ideal situation, you would expect that the NHIF payments would roughly be in the same ratio, 45%, 55%. Why is it not happening? So as a country, these are the types of conversations we should begin to have. Country, we need to ask ourselves what needs to change so that probably 50% of NHIF payments go to the public sector and 50% to the private sector. And if we address that, then you'll be contributing to this financing gap. We'll be contributing to this question of how do we make sure that our public sector, as well as the private sector, is adequately financed. You know, I've had stories whereby, for example, a person goes to a public health facility and immediately the clinician or the health worker recognizes the person as NHIF, agrees, maybe suggests, why don't we meet at my clinic in the private sector? We know those things happen. We need to ask ourselves, why are there no motivations for health workers to help drive NHIF enrollment in the public sector? A root cause analysis around that needs to happen. And this must be a consultative process that includes health workers themselves, the health leadership, the health workers themselves, NHIF, to find a root cause analysis. How do we find balance in this whole conversation of financing from NHIF, the difference between public and private sector? So I would like to commend government, first of all, for moving in and taking steps against corruption at NHIF. So kudos to government for that. Moving beyond that, it's very important then that we reform NHIF to ensure that as a parastatal, there are adequate safeguards uh, to deter and to detect and to stop corruption. So the whole issue of corporate governance must be a very key aspect of the reforms conversation. When you're talking about reforms at NHIF, having adequate corporate governance, sound corporate governance mechanisms will be crucial so that we can put an end to corruption. What I'll tell Kenyans is it's important we have faith that, or rather, it's important to trust that we trust that the current reform process is for good. It is well intentioned. We support it. As Hamre South Africa, we support the current reform process. We commend the government for starting it, and we encourage government working with our stakeholders to take it to the very end so that we have an entity that has a very strong corporate governance, adequate safeguards against corruption. So that's, I think, to me, that's a key message to Kenyans, that this is a process that is ongoing. Government has initiated it. Government, and you all recognize their issues, their challenges at NHIF, corruption, and all that. What I would say is, if you are a member of NHIF, continue paying your membership, because as we start, NHIF continues to pay the premiums, continue to service premiums because he's an acting management, even as the reform process goes on. And if you are not a member, my advice to you is become a member. The parastatal is getting reformed. Become a member, and we know that once the reform process is complete, it will be able to provide world-class services. But then, as Kenyans, we need to be ready and willing to hold ourselves accountable to the promises we give to ourselves as Kenyans. So, if NHIF is undergoing reform, and once the reform process is complete, what accountability mechanisms shall we as Kenyans? Yes, there is corporate governance for NHIF, but as Kenyans, what mechanisms shall we have to, to ensure that whatever the reform process recommends is implemented? And this is where I really would encourage the citizens of this country not to be passive, but to be active in issues healthcare, financing, quality. If quality is not good in that local health facility, what, as a citizen of this country, you have a right to raise your voice. You have a right to complain. You have a right to engage with the service providers, with the sub-county government, with the county government, all the way from the community, county to the national level. And as Kenyans, we need to be courageous and point out when issues are not working and demand that issues are rectified. If you can do that as a Kenyan, if I can do that as a Kenyan, we hold ourselves accountable to the promises we have made to one another, then we will develop as a country. And that is the whole spirit of a democratic society. One is need to narrow its mandate, mainly to revenue correction and purchasing. Number two is a better balance between public, private sector, rural and urban health facilities. Number three is the whole issue of customer centricity, really beginning with the customer in mind and asking, how do we build a product that is suitable for this customer? And there are different types of customers in different segments in this country, and we are all Kenyans. How do we build a product or products that are responsive to the customers that we have? And finally, how do we make sure that the informal sector is part and parcel of this conversation? Not just those who are employed, not just those who are in the formal sector. The informal sector needs to be part of this conversation. And then obviously, it's also important to for NHIF to keep asking itself how well how well constituted is its governance in terms of representing the various constituencies and also making sure that it's lean management, that we are reducing the overheads so that most of the money should not be going to overheads. Most of the money should actually be going to availing the services, to paying for services. So that issue of governance and lean management is also an important and the fifth point that we must not forget. I think we should adopt a hybrid system. Why do I say hybrid? I say hybrid because when you look at Kenya, there are those people who can afford to pay an insurance premium. Those people should pay. I can afford. I should pay that premium. There are those people who cannot afford. There must then be a subsidy program, tax funded subsidy program to cover all those people who are not able to afford the insurance premium, the NHIF premium. We must have clear mechanisms of determining who can afford and who can't afford. Because again, the system can be abused where you find that every person cannot afford. They say that even myself or someone else who really can afford saying they cannot afford just to benefit from that. So there must be clear mechanisms that are founded on community ownership, community structures. And I think where that has worked, it's based on engaging with communities. If you go to a village, the chief, the community of the worker, the people there know who can afford and know who can't afford. So if you work with community based mechanisms, community engagements, like if you think of the current community strategy, if during a dialogue session, community dialogue session, that issue is discussed, it will be very clear in that village who can't afford, who are the people who cannot afford. And then that can be validated by the chief. And then using such organic data, then uh, make sure that tax funded subsidy programs are truly reaching those who cannot afford. You know that this country, we still have a challenge with the number of health workers and the skills mix, especially at the primary health care level. So that's the first issue that we must address. And as we talk about UHC, for us to succeed, we need to invest adequately in allocating resources to make sure this dispensary has adequate number of health workers. This health center has adequate number of health workers with the right skills. Look at the county level, for example, the county budgets. How how much resources are we allocating to primary health care per se? Kenya, as a country, based on the current data we have, I think we are giving about 57% of our resources to primary health care, UHC. I think we need to be getting closer to 75 to 80% of resources going to primary health care. So that when you go to this facility, they have the medications they need, they have the health workers they need, they have the commodities they need, and all that. To have 85% of resources from NHIF going to the private sector and only 15% of the resources going to the public sector, that is contributing to the inequalities we are seeing in this country. Because there are so many people who can never afford to go to this private facility. They can only afford to go to the public facility because of cost issues. So, how do we remedy this whole situation? That's what we need to deal with as a country. What I like to say is that health is a public good, and as a public good, there needs to be safeguards to protect the health of citizens of this country, and that should be our priority number one, to protect the health of the citizens of this country.